Hello, my name is Caitlin Howell, and today I will be presenting to you my global health project on substance use disorder, illicit drug usage. Substance use disorder or drug addiction is defined as a disease that affects a person's brain or behavior and leads to the inability to control the use of legal or illegal drugs or medication. According to the DSM 5, which is used by mental health professionals to diagnose patients with diseases, substance use disorder can be defined if two of the 11 criteria grouped under impaired control, social impairment, risky use, and pharmacological dependence are present. There are about 6 categories to categorize drugs, including cannabinoids, opioids, stimulants, club drugs, dissociative drugs, as well as hallucinogens. Substance use disorder can affect anyone regardless of age, gender, socioeconomic status, race, or ethnicity. Some risk factors associated with addiction include genetic predisposition, meaning you have a family member who is addicted to substances, psychological factors such as depression, PTSD, environmental factors such as exposure to physical, sexual, or emotional abuse, accesses to substances in your community, as well as drinking or using drugs at an early age. Other social determinants of health that can inhibit substance use disorder include policies such as racial segregation or residential policies, which may make one group of people more susceptible to being exposed to drugs, access to health care. Certain patients who have certain diseases, such as sickle cell, may be unable to afford medication or unable to access medication, so they may use drugs that they're easily accessible to them in their community. Availability of community-based resources, so after school programs, and then the quality of education and job training. Common prevention methods for substance use disorder include universal programs, which are typically for adolescents, and drugs and alcohol are addressed in a school-based or community-based environment. Selective programs, which are for young adults who have specific risk factors that put them at risk for having a substance use disorder. Common treatment options include outpatient behavioral therapy, which modifies a patient's attitude and behaviors related to drug usage. Outpatient treatments typically consist of group therapy, family therapy, or individual sessions. There is also inpatient behavioral treatment, which is typically for patients who have a more severe addiction. This is a 24-hour intensive but structural treatment that provides housing, medical attention, as well as therapy. Another treatment option includes medication. So for patients who are addicted to opioids, such as methadone or Suboxone. Another common treatment option is medication. So this is for patients typically who are addicted to opioids. They're prescribed something called methadone or Suboxone, which represses withdrawal symptoms and relieves cravings. Another treatment option, which is not recommended at all, but some patients who are jailed for drug usage or other issues, they end up getting clean. And although this does happen, this method of treatment is not recommended because these patients are unable to receive the proper resources that they need in this environment. Over 2% of the world population has an alcohol or illicit drug addiction. Just over 350,000 people have died from substance use disorders in 2017, 176,000 of those patients being from illicit drugs. In some countries, drug overdoses rank highly on the leading cause of death, including in the USA. In 2017, more people died from drug overdoses than road accidents. And in this table, it just shows worldwide the deaths from substance use disorders by age. So, with the most common age being between 15 and 49 years old. Additionally, this table represents opioids being the largest number of overdoses and reasons for deaths in the world from 1990 to 2017. And the number of opioid deaths has been increasing steeply over the past few years, which is the cause of the new opioid epidemic. In Trinidad and Tobago, the most used substances in the adult population are alcohol, nicotine, marijuana, and crack cocaine. Alcohol is heavily consumed in Trinidad and Tobago due to culture and environmental factors. Not many studies have been conducted on illicit drug use in Trinidad and Tobago due to the fact that a lot of people in the country consume alcohol. The table on the left is just a breakdown of the number of people with drug use disorders, including alcohol, and it's broken down between males and females. Some prevention methods in Trinidad and Tobago include school-based education. So just like in America, having school-age programs about learning about drugs and alcohol and their effects. Some treatment options include treatment facilities, which is a government-funded program that typically lasts for 2 to 6 weeks. Some organizations in Trinidad and Tobago that help with addiction include the CARA Substance and Abuse Prevention Center, which is a government-funded program developed to help patients in Trinidad and Tobago combat drug and alcohol addiction, as well as the Alcohol and Drug Abuse Prevention Program, which is specifically for the population of Tobago, which also helps with drug and alcohol addiction. Substance use in South Africa. So after the apartheid, which ended in the 1990s, drug usage skyrocketed in South Africa. This can be attributed to the effects of the apartheid, including residential segregation, poverty, unemployment, and changes in the government. In South Africa, one of the most common drugs used is cannabis, also known as Dega. Then is methamphetamine, also known as Tic. Next is cocaine, and last is heroin/opiates. In 2017, over 500,000 people in South Africa suffered from substance use disorder, with many of the patients being male and under the age of 50 years old. The most common prevention method is school-based education. So in South Africa, there have been policies that have been enacted that require school-age-based learning on drugs and alcohol. One of the most common methods for treatment in this country is treatment facilities. So in certain cities, including Cape Town, South Africa, treatment facilities are available, but the issue is that many people cannot afford treatment due to their socioeconomic status, the environment that they live in, and access to treatment. Some organizations in the country that are dedicated to educating as well as treating patients for their substance use disorder include the Friends of Health Trainers, which is an international nonprofit program that provides health and drug education to the impoverished youth in Cape Town, as well as Face and Voices of Recovery of South Africa, which is an addiction treatment program in South Africa that provides outpatient treatment to those who suffer from drug addiction in the country. Here is a list of the resources that I used in this PowerPoint. Thank you for listening. The reason why I chose to complete my project on substance use disorder is because my maternal grandmother was suffered from the disease before it was known as substance use disorder. She was addicted to opioids as well as alcohol, and the effects of that are still seen in my family today. I know that I'm not the only one who has dealt with this in their family, and I know that other families have been affected by this globally, so I just wanted to shed light on this issue and talk about what other countries are doing specifically in South Africa and Trinidad and Tobago, which are countries that we talked about in class, and how they are dealing with this disease and ways that they are helping their citizens overcome. So I hope you all learned something from my project and enjoyed. Thank you.